Good morning. I wanted to talk a little bit about stages of addiction. And it's kind of a question that we get asked a lot, is what stage of the addiction are people in? And a while ago, Nora Volkow, who's the head of NIDA, and some others have written some papers sort of outlining 3 stages that are to do with how the brain gets damaged by the drugs and then gets affected by the drugs and then leads to sort of some defined stages of addiction. We know that drug addiction, alcoholism, is caused by genetic vulnerability and then actual use of the drugs, which starts off as voluntary but ends up being something that the person has very little control over. So the first stage is intoxication and binge using. So this is a dopamine effect. We see that happening in the nucleus accumbens and the reward system of the brain. When people use addictive drugs, all addictive drugs release way more dopamine than the brain was ever meant to get. And of course, our brain normally gets dopamine when we satisfy our basic drives for survival with food and sex. And so when our brain gets exposed to those large dopamine spikes, it feels intoxicating, it feels really good, and people like it. And if you have a genetic vulnerability, then you value it more than other people. And so that's sort of the first stage of addiction. The second is what we call withdrawal and negative effects, because what starts happening is the brain gets used to that dopamine, and so it stops production of its own natural chemicals. And when it doesn't make its natural chemicals like its endorphins, then people go through withdrawal when they don't have it. So at that stage, people are using in order to avoid withdrawal. But also tolerance happens, so that people need more and more of the same drug in order to just get a reasonable effect. And so they're now using to avoid feeling bad. They're also starting to notice that regular things don't seem that rewarding anymore. So hanging out with friends and going to a movie and walking along the beach and spending time with children or with loved ones just don't release the same amount of dopamine that they were used to. And so their brain has already started changing for the worse. The third stage is really a frontal lobe problem. It's called preoccupation and anticipation. So what starts happening is the person's worldview starts just narrowing down so that the only thing they're really thinking about is where do they get their drug to avoid these negative effects and to maybe try to get some more pleasure with the dopamine, although most people, by the time they come to us, they say, I don't even get high anymore, I just have to use in order to not feel bad. So the third stage is this anticipation and preoccupation that just becomes consuming. It's a little bit like someone who's got a really bad boyfriend and he's really mean and horrible, and all of the friends of this woman are telling him he's bad news, but she can't stop thinking about him and giving him credit for things that, attributes that he doesn't have, and just really preoccupied with that. So those are the stages of addiction. Of course, they're all happening somewhat at the same time, but there is a progression, and it does, lead us to be aware that it's a brain disease and that this is the way the drugs affect the brain. The solution, of course, stop using the drugs, get support, get therapy, learn how to deal with life as it comes, let your brain go back to normal so that the tolerance and so that the world stops being so narrow and you start seeing the world as all the opportunities that it has available. Creativity starts coming back, and with good help, everybody can get better, but they need to work hard at it. So if you know someone who has a problem, or if you have a problem, please get some help.